What is hypogonadism? To fully understand hypogonadism, we must first understand the meaning of the words that constitute hypogonadism, which are hypo and gonadism. Hypo means under or deficient, and the gonadism refers to the affected glands, which are the gonads. The gonads are the male and female sex glands that produce the male hormone, androgen or testosterone, and the female hormones, estrogen and progesterone. So what are the types of hypogonadism? Hypogonadism have two types, primary and secondary. Primary hypogonadism is a type of hypogonadism where the problem is in the sex glands or the gonads. The secondary hypogonadism is a type of hypogonadism where the problem is in the brain, specifically in the hypothalamus or the pituitary gland. The primary hypogonadism happens when there is a problem with the testicles or the ovaries, which are responsible for the production of male and female sex hormones. The causes for primary hypogonadism are genetic disorders like the Turner syndrome and Klinefelter syndrome, infections like testicular mumps and orchitis, radiation exposure, and surgery on sexual organs. They cause hypogonadism because they affect the gonads that produce the sexual hormones. The lack of those sexual hormones causes hypogonadism. The secondary hypogonadism happens when there is a problem with the hypothalamus or pituitary glands. Hypothalamus controls our hormones. It sends signals to the pituitary glands, which secretes hormones to other organs. If the hypothalamus is affected, then it can't send signals to the pituitary gland that is responsible for secreting hormones that stimulate and regulate the gonads. There is another case where the hypothalamus is working but the pituitary gland is not functioning properly. If there is an issue with the pituitary gland, it will not be able to secrete hormones that stimulate sex hormonal production that will cause hypogonadism. The causes for the secondary hypogonadism are Kallmann syndrome that affects the hypothalamus, inflammatory diseases like sarcoidosis that can affect the brain surgeries, use of steroids and opioids, injury or tumor in the hypothalamus or pituitary gland, and radiation. Signs of hypogonadism: depressed mood, decreased libido, sleep disturbances, loss of body hair, and decreased muscle mass and strength. Hypogonadism can manifest itself during fetal development, puberty, and adulthood. During fetal development, it can cause impaired growth of sexual organs. A male baby may have female genitals or have undescended balls, and a female baby may develop male sexual organs. During puberty, it can cause the delay of penis, testicles, and muscle development and may affect the deepening of the voice for boys. For females, it may cause the delay of breast growth and may also cause menstrual irregularities. During adulthood, it can cause decreased sex drive, decreased energy, and depression for both male and female. Adult males can develop erectile dysfunction, development of breasts, and loss of bone mass. Adult females with hypogonadism will have a hard time getting pregnant because of the lack of female sex hormones. Treatment. For men, it can be treated by having a testosterone replacement so that the testosterone levels can become normal. For women, it can be treated by the consumption of pills that stimulate ovulation.